Hi everybody, I am Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with collagen stimulation as well and facial balancing. I'm going to do something a little bit different today. I'm going to go through how I analyze scars. I'm going to walk you through just my diagnosis as well as the different treatment options that I would have for patients. Some people had submitted some photos over here, and I'll go through just what I would do for these patients. And also I'll start with this patient that we had shown just a few days ago. You'll see just how we worked on his scars, and I'll go through just what I did for his consultation process. So let me pull that up right now, and you can see actually, let's see here if I could see it. Yeah, perfect. Let's see if I could get this to get a little bit resized for you. I'm going to make it so that you can see this pretty well. We're going to go through just like the different steps that we have to do for scars, and especially when we're talking about patients with this kind of scarring where there's really a lot of volume loss over here. There's what we call boxcar scars and rolling scars. A lot of times what I have patients do during the consultation process is I have them actually smile or animate, and I really touch the skin and double check to make sure that these are things that we could improve with subcision or with laser or with volume restoration. So I'll go through here. You can see, hopefully you guys can see this pretty well. Actually, let me zoom in a little bit more. I'll zoom in here, and let's see, actually, let's get a little bit closer to here. Okay, so if you look right here, you can see these big boxcar scars. So these kind of scars right here, this is what we do. We actually, let's put this in this color, and I'll go in and I'll show you kind of, this is how I normally do the consultation process here. So I'll go through and showcase for you guys. These little red dots, these are where I do the TCA. That's an acid I place at the base of the scar. So I'll show you, let's say we do a virtual consultation, and you show photos, and you know the really nice, beautiful, clear photos like you're supposed to send. I'll basically walk through and showcase for you then what I'll do for your particular skin type and then your scars. So in this case over here, we have some fat destruction, we have these boxcar scars, and these little red dots. These are the areas that we're going to place a little bit of acid called TCA. So we'll do that acid there, and we'll do that at the base of the scar to trigger a collagen response. Hi, Mrs. Jones, good seeing you on. And you can see all these little red dots. So I don't do just the boxcar scars, and a lot of times people say, well, you can only do it in ice pick scars, but we could actually do it in the boxcar scars, totally fine. We could do it in the rolling scars, it's fine. What I do is I just, okay, yeah, so someone's saying if I could center the photo, hopefully that's a little bit more clear for you now. Hopefully you guys can see it a little bit better right now. Let me know if you can't see it, because my first time trying it this way, let's see, hopefully you guys can see it. I'm trying to see if you guys could. Okay, perfect. You guys hopefully can see it. Oh, hi, Thailand. How's it going? Yeah, this is, I'm going to try something here. We'll see if you guys could see it okay. But I'm going to go through just kind of what I see when people send photos, and this is what I'm looking at. I'm looking at just basically, this is a patient. He's not even smiling right now. He's at rest. There's a lot of fat destruction here. You can see that fat destruction because you can see this whole indentation right here in the mid cheek. And we know when there's this kind of indentation with this kind of scarring, and you can see it's clustered together right here, that we're going to have to go inside and actually break up that scar tissue too. So that's another part of this, which is going to be subcision. So these red dots, these are some of the areas that we're going to be doing TCA. And then I'll show you, let's say with, let's do a blue marker here. And we'll showcase now for you guys a little bit. Oh, sorry, I have to center this every time I change color. I guess I'll have to stick with the same color ink actually, because it looks like, otherwise it doesn't get it zoomed in. So take a look at this. You can see, we can see these thicker areas here of these scars. So this is where these guys right over here, for example, this is where I'm using that ablative form of the CO2 laser. The CO2 laser basically to smooth down the edges of the scar. So I do something very, very different compared to a lot of people. I actually smooth down the edges of scars, not just going around and doing something like a fractionated blend of a laser where a lot of people will just basically just laser everything the same depth, the same energy. I'm going around and kind of like surgically cutting out that excess scar tissue. So see this whole process right over here. I'm cutting all this out. And you can see it when I do the laser. You know, anybody that comes close, I have a lot of physicians who round with me who see it. They never saw that anybody do this before. And it's what I found is like super valuable for these kind of scars. You're really going at it, and each of these individual spots, we were just going to go stop and smooth it down. I'm going to answer some questions as I'm going along here because I know I see a bunch of questions here. Could you do punch excision for these scars? That's a good question. Let's kind of reverse a bit here about punch excision. So the question is about punch excision. There's not really a great spot just to excise, and then really there's basically, if you take out, let's say you take out this scar right over here, there's going to be a bit more tension right here, because what it's going to end up happening is you take this guy out and the rest of the area around it is really scarred. So it doesn't heal as nicely. There's still a big pull on that scar. Hopefully you guys can see my my cursor. But what I was saying was that, let's say we take out this scar right over here, for example. Now, the scars around it actually make it so that there's going to be more tension over here on that particular scar. And you end up then basically so that the scar could get wider then, and it doesn't heal as nicely. So instead, I smooth down the edges of it. And in those little red dots that I had over there, that's where I place TCA, and that helps the scar rise. And then, of course, the other process for this is going to be undermining the scar tissue over here. So we're going to go inside here and we're going to break up that scar tissue. So I go in and I go underneath the scar and I manually release all the bonds, all the tethered scars here. So I do all that actually, and that's really, really critically important. Like, this is really stuck. This patient, very, very stuck scars, and there was no way of getting an improvement unless I broke up that scar tissue. And really what I did here is I gave you like the order that I do things on. I'm basically like a pilot. I have a certain order of doing things, and it's like on purpose that way. I want to make sure that as I'm doing this, I'm doing step by step. I'm not missing anything, and it's really just like very clear for me when I'm working on the type of scars that I'm going to maximize the patient's results by not missing any steps and doing everything the way it needs to be done for these kind of scars. So I basically, what I said is I did TCA CROSS, and then I did some CO2 laser, which is an ablative form of the CO2 laser around the edges of these scars, and then I end up doing subcision. And then I do another blended form of either fractionated CO2 laser or erbium laser now. So yeah, again, a few steps here, but it's consistent. Like I just did it over and over and over again, where we could essentially make sure that it's always going to be the same kind of result for patients. And it's fun because, like, you know, it's every single time I look at this, it's a puzzle. Every single patient's a bit of a puzzle here, and how to solve that. So that's really, you know, I know I skipped a whole bunch of questions, but hopefully that's a little bit clearer. Then you can see, I'll show you guys, let's see, as we pull out of here, let's see, you can see this patient's result here. Let's see if I can get this so you can see it better. So this was with, in this case, we did really with subcision, TCA CROSS, we did CO2 laser, and then we then subsequently did fat transfer. So we had to do that subcision portion of things in order to get the layer that we needed to be able to do fat transfer afterwards. So that's the process here. That's how we ended up doing this. And it's really, again, like I said, over and over and over again, something that you could do. It's just a matter of doing this in a step, really systematically. It needs to make logical sense for the particular kind of scars that we're trying to treat. Thank you guys so much. Appreciate everybody that's on here. I'm glad this format is working well for you guys, because it's my first time trying it that way. And I was originally going to make it a lot more complex on my computer, and then I realized that there's this easy way that I could do this now. And it's like, okay, cool, let's just show it this way. A quick and dirty way of basically highlighting the scars that people have. I saw something here. Why are you interested in acne scars besides the obvious that you dealt with acne as a teenager? I just think that it's important to focus on things, and you know, in order to solve things properly, you have to focus on it early. That's what it comes down to. I think that in order to do things really, really well, you have to do it over and over and over and over again. I grew up with Michael Jordan, and it was like clear that he just had to do something over in order to excel at something. He just kept on practicing, like even though he was the best in the world, just kept on doing it over and over and over and over again. And that muscle memory just like needs to be there. So if you don't have that, I think you just can't do it at a high enough level. It really, that's what I truly believe, that you have to just constantly work at things and to excel it, you just go in and out of it and understand it completely. And live and breathe it, and like that's just like how you get the best. And this really deserves somebody to like really focus completely on. You know, scars just affected people so dramatically and so terribly that I think that it just really, people were suffering for so long. One of my patients today, she drove so far from Central California today. And she's a patient of mine for a while now, and she ended up doing TCA CROSS elsewhere. She did it over in the Bay Area because she said it was closer to her, and they burned her. They you know, all the hard work that we had done. They had widened scars. She was so traumatized by it. She said that she couldn't even go to her daughter's soccer games for so long, for weeks and weeks, because she's been traumatized and horrified by it. And the problem is that that's what you see. You know, either it is ineffective, or people do things that just you know, are reckless and dangerous, and they could destroy damaged skin. So I was like, you know, we just got to do things now at a certain point now, just and get a better result for people, and do things that they that we could all feel proud of, and they could feel happy and more comfortable with. I'll show you this patient. She had messaged a few times now. She wanted me really to go through her case. She had put it up on her forum, which I'm slowly trying to build out as like a guide for people. So let me see if I could zoom in on this one. This is a pretty, this wasn't too difficult really for if we ended up doing this one, but she's just somebody who just submitted a case here and wanted some help to see how would she solve these scars. And I'll show you kind of, hopefully you guys could see this one also. But these scars, this is not too difficult again. These are atrophic scars still. There's a big indentation, some fat loss over here. So right over here in this, I guess you could, let's pull it this way here. Let me do it this way. And actually, let's try it. Okay, so hopefully, let's see if we could do this. There. Okay, so this guy over here, there's a big pocket of fat loss right here. And there's these boxcar scars scattered around here. There's some oil production though. There's quite a bit of oil production. And that oil production, we got to control better. We really want that oil well controlled before we manage these scars more. And ways to do that would be to have the patient on topical creams. So let's see. So we're saying that we can't see it too well. Okay, I'm going to try to circle back with this one then. But basically what I was saying is that we want to go to, let's go back to this patient here. What we want to do is we want to do topical creams typically. We want to do topical creams, or we do spironolactone, low-dose Accutane, or we do the Accure laser. All options really to control oil production. The problem is though that a lot of people actually, they think that because it wasn't as bad as it was before, you know, they think, okay, well, you know, I used to have really terrible acne. It was really bad, but clearly it's not as bad anymore. You know, they think that then it's like, you're ready to go. It should be done. But the problem is that really that oil is inflammatory. It's a process really that could delay your collagen response, and we may not be able to get the best possible result while you have that oil production. So we got to control that a little bit better. I'm going to try to see if I can still pull up that photo. Otherwise, I may have to do it tomorrow. But essentially, the process actually for a lot of patients is that we got to control acne and oil first. So with the Accure laser, or we could do things with topicals. Which topicals? So John's asking, which topicals decrease oil production? I thought overproduction was a rebound effect of dry skin. You're actually correct, John. A lot of it is that, but it's not the only process, because sometimes it's just from hormonal changes. Sometimes it's due to your diet. There's a lot of different factors that could cause oil production. And the goal is really to still make it so that it doesn't actually respond the way it did before. It shouldn't ever respond that way. It should be that it's well controlled, and even if you happen to go like on a dairy binge or your hormones fluctuate, it doesn't actually change too much there. Let's see. Taylor saying, got off Accutane but have some scars and uneven skin. What treatment is the most effective treatment? The reality is it depends on your scars. Sorry, one second. Let me let my dog out one quick second here. I'll show. Actually, someone was asking for temple scars. Let's see if I have temple scars here. Oh, well, here's a good result. Here's some temple ones here. So I'll pull this up for a second here for you while I solve what's going on with Izzy here. Let's see here. I'll make this bigger here. One second. Okay, sorry about that. So when we talk about, let's see here, we were talking about temple scars. So temple scars. This is TCA CROSS, laser, and Bellafill in this case. So TCA CROSS, laser, and Bellafill could work very, very well for temporal scars. So you can see for this patient, worked incredibly well for her. And a lot of times you don't have to use too much energy, too much heat in order to solve these kind of scars. You actually could just go ahead and solve a lot of the fat loss, that volume loss that occurred. You don't have to do too much with lasers and energy devices. Let's see, I know I missed a bunch of questions here. Tyler saying, do you think over the years you've only gotten better at scar procedures, kind of like a long-term art skill? Yeah, I do think so. I mean, I do think so. I think that it's like, I do look back and I see that also the recovery process is a lot faster for patients. I think I solved a lot of like the recovery process too for patients. So that helped out, made it so that's a little bit easier for patients too. I think you have to just do this over and over and over again. And like now it's like, I clearly am feeling like I'm just like completely focused and just completely at my peak. It's like nice because I don't have to worry so much about a lot of other stuff going around, like for the office, things like that. Everything else just relaxed for me. And it's like, I don't have to worry and stress about it. And then I can focus more of my energy and more of my time on just getting better and better at this, which is really good for me. It's like, I think that, there's too much sometimes with like everything else that goes on, and you like kind of like just setting things up and like trying to grow. And there's a lot of people out there, like a lot of people are supportive. A lot of doctors are supportive, but then there's also some doctors who aren't, and they just waste your time. They waste your time by not being like, just by, it's like, it's nice just to have it like where you can just feel like you have a nice supportive community now, and you can just focus on just getting really, really good, amazing, consistent results and do it over and over and over again. It's really fun that way. Does insurance cover this? I wish it did. You should talk to them. It does not cover that. Unfortunately, it does not cover that. It does not cover this. I wish it did. It would be really, really nice. It'd be really nice for a lot of people that suffer from scars if insurance did cover this. Does Volufiline work? It's remains to be seen. I think it may help a little bit, but it's certainly not going to help enough for scars. These are pretty complex scars. Most things are not going to be solved with just volume replacement. You do get a little bit of collagen stimulation, of course, with that. But the problem is that you still have to do subcision. You can't like skip steps. You got to go and break up that scar tissue. You have to do that. Otherwise, you're never really going to be able to get an excellent result really with any of those. Can you still do subcision after getting CO2, or is that suboptimal? Ideally, you should do subcision first. It's okay, but you could do that. But first, you have to do the subcision part, though. Ideally, really, first thing you want to do is actually you want to break up that scar tissue, and that way you can lift up the scar a bit there. You want to lift it up a bit there. So subcision typically is first, but I do it all at the same time. Usually, it's okay. And if you happen to do it afterwards because, the person you went to didn't do subcision or so, that's okay. It's not like it was bad. Hopefully it'll stimulate some collagen, improve your skin a little bit more there, but not going to be quite enough though, typically for a vast majority of patients with rolling scars or like deep boxcar scars. Let's see here. Is this from subcision? Yes, this was with subcision, TCA CROSS, and laser. So we did a few different steps there. This is a few different things here. Is CO2 laser good? I did do CO2 laser here in this case, but it wasn't only CO2 laser. I did it for the edges. So as I showed for that previous case earlier, you can see the thickness of the scars over here. I went along over here and smoothed those down with the CO2 laser. And I had to do it, this was a case, actually, I did a couple times actually with more of that ablated form of the CO2 laser. And then we also did TCA CROSS, we did Bellafill, we did subcision one time there. Let's see here. Thailand's asking, what do you think is the most rewarding part of being an acne, scar, and skin specialist? It's changing lives, really. I mean, I know it sounds like a lot of people would say those type of things in the medical world, which is awesome, actually. It's a good thing. But that's like awesome. It's really fun for me. It's really fun for me because I just I look at this and I really do wish that this was around when I was around, and needed scar treatments. I do. I really wish that this was these type of procedures were available for me. I think it would have helped out a lot with my mental health. I think it would have made it so that I didn't have to focus on this. I didn't have to stress about this. I wish that there were more things for acne originally. I wish I didn't have to suffer from acne. I wish it was taken more seriously. I wish that I was told what to do properly, and people really understood it better and paid attention to it more. So it's rewarding to be able to have this where you look at somebody and you start 6 months ago or a year ago or so, and you solve their acne, then you solve their scars, and sometimes you solve their pigmentation, and you do all this, and it's just changed their whole pathway in life. And it's a really, really cool process. It's a really, really cool feeling. It's Lino saying, how many TCA cross sessions are needed on average? So it could take actually about 4 to 6, depending on the scars. Like this patient needed about 4 to 6. I can't remember exactly how many, but she needed about 4 to 6 sessions over there. Hi, Alan. Good seeing you on. I think you're coming in again too, right, Alan? At some point, hopefully I'm seeing you again soon. But typically it's about 4 to 6. Alan's saying he's going to come in about 2 weeks, which is going to be awesome. Alan's been having amazing progress. He has very, very deep scars. So it's going to be an amazing process actually for him when we end up getting his process improved. What do I think of the LaserAway lawsuit? I'm not too familiar. I didn't look at the details of that. I did not look at what was specifically what's happening with it. Do you guys know what was going on? I'm not entirely sure of what was going on with the LaserAway lawsuit there. To be totally honest with you, I don't really particularly pay attention to them or what they're doing or anything like that. So it's like kind of just a totally different world what they're involved with. But I'm sure that it'll be nice if people did focus more on what they could do. And LaserAway, I think, probably does a good job with like laser hair removal. But I've had patients who've gotten, $10,000 worth of scar treatments from they were told to do clear and brilliant and microneedling, and they got no results from over there. And that's what they told me. That's what they said. They said that they did $10,000 worth of treatments, and it's not just like one person. And they had severe scars. Actually, my patient, he's going to come in July. I did a phenol peel on him. He lets us share his full results, and you'll see, it's terrible what they did to him. They did so much with just pulling him, doing these scams like this. Sorry, not scams, but like these packages, I should say. And they got him to do all these packages, and he ended up just spending $10,000 worth of treatments that just were ineffective. So, I'm not sure if that's what that's about. I know someone's asking about skin laundry. What are your thoughts on skin laundry laser resurfacing? I'm not too familiar with them doing laser resurfacing, to be honest with you. I didn't even know if they do laser resurfacing. I thought they were more just like a light laser facial type of place. I didn't even know if they did. Did they do laser resurfacing? I don't know. But they're not even, I don't even think, around in my area anymore. I think that they shut down. I think that they had a few locations, and I don't think they're around anymore. Narishma is saying, hello, I hope you're doing well. Thanks for your help last week with my acne scars. I am looking forward to amazing results. Thank you so much for coming on. You will get amazing results. It's just over time, it's going to get better and better. You will see. It's going to be awesome, really. Ultimately, it'll be really, really a fun process to see your journey there. Mr. White saying, hi, Dr. Qazi. How do you decide which filler is best for each patient? So it depends, for some patients where there's a lot of fat loss, in that case earlier, I showed you, a lot of fat destruction. We just did fat transfer for that patient, and that worked out incredibly well for him. But there's some patients that don't have much fat to give. There's some patients that opt more for more permanent options like Bellafill, that's a softer product. You need some more of it, but it does ultimately work very, very well because it's more permanent. So even if you lose a little bit of weight, lose a little bit of fat, you have something there to support your scars. So very, very helpful for a lot of patients then. And then there's some patients that really, for some people that do have fat loss, but they don't really have much fat to give, they have a lot of fat, let's just say, then sculpture could work well. Sculpture works well, and PK Farnsworth's on here. He's familiar with that as well. PK is saying, thank you so much for this case tonight. Regarding under eye filler, do you ever choose Bellafill rather than HA filler? Any good use of Bellafill around the eyes in the hands of an expert provider? Good question. I mean, usually you don't want to go too close to your tear trough, but just right here in the orbital bone, the mid cheek, you could potentially do something like some Bellafill there. But it's something to be really careful with. And to be honest with you, I gotta take a look and see if you're a candidate for that, because I thought that your under eye area was pretty good. But I could take a look and see. We could take a look and see if that's something that we should do. Let's see here. It looks like people are saying that they couldn't see me properly. Let's see if I can fit this better. There you go. Did I change my times of my lives? No, I just was off yesterday. I may end up kind of cutting down on Mondays though, and I have a baby coming soon, so we'll be off for a week when that happens. Who knows when baby comes? So it's coming soon at some point, but when baby comes, I'll probably be off for a little bit of time for that. So I'm trying to just keep doing everything right now. Is my sister okay? No, actually, that was I lost my sister actually 4 years ago. And I just decided I don't want to work on that day, like when that happens. So I don't work at all on that day anymore. So, but thank you for that. Thanks for asking. But that's actually what was going on. But thank you so much for that. But yeah, so she passed, and it was like just one of those things where I just felt like in order to be like just do this at a very, very high level and focus, I just needed to just not be like in the office like that, and just like I just wanted to focus with my family and just like talk to all my family, my parents, my other siblings, and so that's kind of what I do on that day. Cynthia is asking, do people typically see results or after the first sessions? It depends, depends on the kinds of scars. It really depends. The thing is that the rolling scars with fat destruction, those ones you can see kind of quickly. You can see that like 6 months, a year later or so. It looks really, really great with some subcision and doing volume replacement. It looks awesome. And other scars, like these kind of scars, could take a lot longer. This could take almost, a year and a half to 2 years there. So it could take a while. Thank you guys so much. Appreciate you, Stephanie. Appreciate you, Buttercup. Thank you guys. Al Max is saying, I just had some filler dissolve to it's compressing a nerve. I'm thinking to go see you to dissolve more. I'm feeling puffy. I will be happy to do that. I took care of that actually just today, actually, with a patient who had it about 8 years, and it was just in the mid cheek. It was causing a lot of swelling. Here and there it'll get worse. She said in the morning time it'll get worse, and sure enough, she had gotten some dissolving agent before, but doing it under ultrasound, going directly in the pocket of a filler, it works incredibly well, relieves the symptoms amazingly well. So it looks awesome. Thank you so much, Tylen. And appreciate you, Tylen, too, for that. And sorry you went through that loss too. Really, really sorry to hear that. Do scars go away on its own over time? It depends. It depends on how deep and thick the scar tissue is. It depends on, if you're picking at it, if you're letting it heal. One thing you could try to do is put silicone tape on there to see if that'll help it heal, or hydrocolloid pads. That could potentially help it heal. You got to take care of it early on so it doesn't end up causing more of more scarring down the line. It's tough, though. It's tough to say if it necessarily is going to heal completely still. And you may need to see me earlier. A lot of times it's better to see me early. Sophia is saying, thank you. Congratulations on the baby. Thank you so much. So yeah, I'll let you guys know. We'll put it on a little announcement when that ends up happening. I feel like it may happen soon. We'll see. Sierra is saying, the photo that is on the screen, how many sessions has been done for her? Is this the final result? It's not the final result. We'll still end up doing a little bit more TCA CROSS and some Bellafill. When she came in this day, actually, we did a little bit more TCA CROSS and some Bellafill. And then I'll see her again at some point, and we'll do some more at some point. Do you use ultrasound to inject filler? I don't think it's going to help too much, honestly, really for patients. The truth is that you got to just actually make sure that you're moving your cannula a lot or your needle, and there's not really going to be too much of too much improvement actually from using ultrasound for filler, at least that I could see right now. But as we learn more and we see things that I'm open to it. It's just I'm not sure like right now what it would really change. I haven't really needed it ever for that, and I think my filler work is really good so far. So If that's like, if something I look at like it's going to improve things, sure. But right now I just don't see what it'll really improve other than it would be like a little bit cumbersome to do. Mathel saying, what about forehead scars? Can those be done? Is it realistic to get good results on them? Yeah, it's awesome actually. Forehead scars are awesome. I showed that case earlier. Forehead scars work very, very well with subcision, TCA CROSS if you need to, and volume replacement. Volume works incredibly well on the forehead. So if there's fat loss, fat destruction, volume. Can you just use a bunch of retinol or retinoids creams to make this look better, such as retinol? Well, you could try. It's not going to help enough. It won't help enough, though. Is it relatively easy to solve the underlying appearance of shallow rolling scars without subcision? Possibly. Sometimes it doesn't. It's a slow process. You go a little bit, do a little bit, wait, do a little bit, wait, do a little bit, wait of like some subcision because you don't want to overshoot it. You don't want to overshoot it there. Does beef tallow help with this? I don't think it's going to help with the scars, although there's vitamin A in it. It definitely feels like a retinoid to me. It definitely feels like that. I've been using it every night. I think it's been good for my skin, though. It's been really, really good. I've been using it. I've been mixing it with with our pigmentation cream. Works very, very well. But I don't think it's going to solve scars. I don't think it's going to solve these kind of scars, especially not going to solve. But it's actually kind of interesting because I think it does work pretty nicely for skin just overall. It makes it feel like it's glowing. And I just got to figure out like what that vitamin A, when I have some time, what the concentration is, because it doesn't even tell you what the exact concentration is. Retinoid minimize my scars. You can't even tell I have any, so I'm so happy. That's awesome, Incubus. That's so good. I'm so glad. It mostly it does stimulate collagen production. It helps shrink the diameter a bit there. So that's what you probably saw for your kind of scars. It could probably help a lot. Let's see here. Where was I at? I lost a bunch of things here. Jadugar saying, come to India, sir. Thank you so much. Thank you. Appreciate you. I had a patient I just followed up with today. I actually had to double check if he lets us share. He had really bad chickenpox scars. I just followed up with him. It's almost invisible now at this point. He's a physician, actually. Came all the way from Hyderabad, India, flew all the way in, came in for a day, got the procedure done, and he's got a killer result already. So absolutely, we have patients from India, and of course, Indian Americans over here who I take care of a lot of our patients, and we're able to get excellent results over and over for them. Please pin what was used. I actually don't know how to pin comments, so I'm like, I'm not capable of that, but I'll tell you, I did TCA CROSS, I did subcision, I did laser. In this case, I did CO2 laser as well as erbium laser. I did some Bellafill, and then through the laser channel holes, I put a dilute form of Sculptra for this patient. So I ended up doing that. I didn't even know you could pin comments. That's actually kind of cool. I'm going to try to figure that out one day. Looking forward to see you in September. Fernando's saying he's going to see me in September. Look forward to it too, Fernando. Look forward to that. I will see you soon. Hello, doctor. I'm on Accutane. I'm not purging anymore. What scar treatment can I safely do? Well, it depends on the dose that you're on. As long as it's not too high of a dose, it's something that we could typically do. Vast majority of these treatments we could do. I usually don't use too much heat, too much energy for my lasers. So most of these treatments you can end up doing. So let's talk. Hannah is asking about keloid scarring from acne. What do you recommend? You want to do a few things. Sometimes you have to do a little bit of steroid shots, but there's still this red vascular, like it's angry looking. You may have to use a laser like XLV potentially could work out. So that could be the option there for you, XLV or V-beam. Let's see here. Tylen's asking, in the future, will I need to do CO2 laser for smoother results, or will it just continue to be the fractionated laser? Oh yeah, we could do CO2 laser. It's just that in Asian skin tone, there is more downtime. Expect a little bit more redness. Sometimes the redness could end up getting hyperpigmented, darker. So there's that aspect of it, but it does get a little bit faster and more collagen production. So we could consider that. Ganesh is on here too, and he's saying that if I could open up a clinic in India too. Appreciate you too, Ganesh. Thank you so much. And this looks like a few people now from India that are requesting a clinic over there. Thing is that I want to make sure that everything's done extremely well, and my team over in our office over here at Newport Beach, California, we can make sure it's done extremely well, very safely over and over again. So that's the thing. So that's why I don't travel around. That's why I don't bounce around. I try to just keep it really like focused on in my area for right now. But certainly, I'll take a look and see. There's other areas out there right now. there's a lot of stuff that's going on in the world. But who knows what we can end up going for additional spots for a bit. A is asking impetigo leg scars suggestion. So usually those are more hyperpigmented. Correct me if I'm wrong, but it could also be that there's a bit of indentation there. If it's hyperpigmented, you want to be on something that's going to suppress that pigmentation. So something like hydroquinone could be prescription based. If you just want to try something over the counter, Eucerin's pigmentation cream works well. And then Pico laser could help well for the pigmentation. And then if you need to, you could do, even on the leg, you could do little bits of Bellafill over there. That could actually work out pretty well. Will acne scars 100% go away? It's not important to say the 100%. That's why I always say, is it possible? It's possible, but just don't focus on the 100%. Just don't think about 100%. Just think about how it's going to be less visible, less obvious to you, to everyone else, and you're going to feel much more comfortable and confident in your skin. That's what the whole point of this is. That's what we're going to try to do. Yesenia is asking, will an ablated CO2 laser in subcision give good results for a moderate case of rolling scars? Most likely, but you probably still need a little bit of volume. So like Sculptra, Radius, all those options. Is Botox for men too? Yeah, why not? Honestly, I've never been a person that says that these kind of treatments can be only for men or only for women, unless it's something that's going to alter hormones or so, like spironolactone for acne you wouldn't give for men, for example. But otherwise, I don't know why wouldn't you? Men also shouldn't have something that upsets them. If they feel like these deep lines and wrinkles are things that are holding them back or making it so that they look older than they want to appear, then absolutely, why not do something about that? And sometimes it's also just the anger or the anxiety sometimes that occurs with the 11 lines. Reducing that is actually really helpful. It improves people's moods. So there's a whole added bonus of that, actually. Just people feel better about that. The fact that they're not as stressed, or even just looking at your computer screen. Sometimes people, when they're looking and concentrating, it just starts hurting over here and you start getting a headache. So it reduces that. So there's a lot of other side effects. Prozac is saying, I'm 1 month post-op rhinoplasty, which is ultrasonic. Is there a time frame I need to wait before I'm eligible to book an appointment for scar treatment? From my standpoint, no, it's okay. We don't have to worry about anything for me. In fact, we don't even have to go over the eyes. Our goggles could just be these little stickers that you could use that are these little shields that we put over the eyes. So we don't even have to touch the nose at all if you don't want it. So that's no problem. Is the procedure safe for people that are diabetic with type 2 if they want to go through acne procedure? Yes, as long as your A1C is well controlled, and typically we want it less than 6. If you're type 1 diabetic, then sometimes 6.5 could be okay, but type 2 usually 6.0 or less. So we want that better control there. Thank you guys so much. I will see you again tomorrow. So it looked like people liked that way. I was circling. I'll try to get that arranged again. It was kind of hard for me to work on the computer just now, but I'll try to figure it out a bit more. And if you feel free to send more cases for me, but I'll show you some of my older cases and kind of circle and basically show how I solve the scars and what I would do step by step for your particular scars. And 24 Hours is asking if my acne scars look like the after, should I still consider treatments? Well, this patient, we're still doing treatments because she wants it as smooth as possible. So it just all depends on what you're trying to get to, where you are in the journey. You'll have to determine that if it makes sense for you. But yes, we can still get improvement. Thank you so much, Thailand. Appreciate you. I'll be happy to